Hi, my name is Laura and I've decided to come today to get evaluated for surgery. I've had glasses since I was 10 years old. I'm short-sighted and I'm pretty blind without my glasses. I've had the majority of my life, like longer than I haven't worn glasses, so I feel that I'm a little bit self-conscious when I don't have my glasses, so that's what has me nervous today. I think it'll be very exciting when I do get the surgery done to be able to see everything like birds in the sky and be able to buy some sunglasses, which I haven't been able to do in ages, from Pennies or Dunn's. Yeah, I've heard about the clinic and the clinic's meant to be great. My surgeon is Dr. Cummins. I heard he's really kind and I'm excited to meet him.
Mr. Arthur Cummings is owner and consultant eye surgeon at the Wellington Eye Clinic. Since 1994, Mr. Cummings has been performing procedures to change the way people see. He's internationally renowned in his field. He's actively involved in research and lectures in refractive surgery. At your first consultation, all tests will be carried out by a surgeon. They'll advise you of the procedure that you are suitable for.
Refractive surgery is corrective surgery of the eye designed to improve the focus of the eye. So primarily it gets people out of glasses completely, or it improves their vision. It's become so successful that both myself and my two sons have both had it done.
LASIK is the commonest form of refractive surgery that we use to make people see clearly, better without their glasses or contact lenses. Today it's performed by two lasers. The first laser is a femtosecond laser and cuts a very small flap. That flap is then lifted and a second laser changes the shape, the curvature of the cornea. The flap is then repositioned. It's painless, it takes a few minutes, and within a very short space of time you're able to drive and do everything that you would normally do without your glasses.
The recovery period of LASIK is what makes LASIK so appealing. The recovery is incredibly quick. There's some studies currently underway in the US that are showing within 2 hours that 50% of patients have 20/20 vision. So the recovery is super quick, and by the next morning the huge majority of patients would have 20/20 vision and could basically go back to work.
LASEK is laser treatment on the surface. There is no flap. It has exactly the same excellent outcomes as LASIK. Now, we use LASIK sometimes in people depending on their profession, if they are involved in contact sports or if they have jobs in the military or in firemen. However, as surgeons, we may prefer to use LASIK in patients who have slightly thinner corneas, dry eyes, or even smaller eyes.
The recovery period with LASIK is typically in days rather than hours, as it is with LASIK. And if it wasn't for LASIK, LASIK would have a very fast recovery period. It's only when you compare it to LASIK that it would be as slow. But generally speaking, within a week you potentially have vision good enough to drive, and at 1 month your vision would be as good as someone who's had LASIK done. And by the time you get to 3 and 6 months, there is no difference.
Mr. Richard Corkin is partner and consultant eye surgeon at the Wellington Eye Clinic. Specialising in ophthalmology, he's been correcting people's vision for nearly 30 years. Mr. Corkin has been with the Wellington Eye Clinic since 1998. The clinic is both owned and led by Mr. Arthur Cummings and Mr. Richard Corkin. From your first consultation at the Wellington Eye Clinic, you'll meet and consult with one of our surgeons.
Hi, my name is Mark and I'm here at the Wellington Clinic, where I decided to come to see if I was suitable for eye surgery. I had made an appointment several times before, because my son-in-law had been here and got the procedure done and he was really happy with it. I was here last Monday and was tested. They said that I was suitable for monovision surgery, and they gave me lenses to put in for the week to see whether or not I was happy with perhaps what I might be seeing if I had the procedure done. So off I went on Monday with the lenses in, and I think the first thing I noticed in the car on the way out of here was just reading registration plates. It was just a bit of fun because I wasn't able to see a registration plate before that. So I got back to work, and of course the business I'm in is a restaurant business, so taking orders, reading wine labels, looking at orders, looking at menus, describing items on the menu to customers without having to look for my glasses was just an absolute joy.
Laura has arrived at the clinic to have LASEK to correct her distance vision. We may perform some additional tests on the day of the procedure if needed. Before your surgery, you will meet with your surgeon again, who'll answer any questions that you may have.
Yeah, I wouldn't have any excuses. I'm out of the procedure and everything went great. I went in and I had somebody to hold my hand, which was a great comfort, and I had a stress ball, which was nice. And Dr. Cummins was great. He walked me through like each part of it, and I think no matter what, you're gonna feel a bit nervous going in, because it's a new experience and you don't know what to expect, but it's quite simple in there.
Laser surgery, whether it's LASIK or LASEK, is both done by reshaping the cornea, and the effects on the corneal shape are permanent. We do sometimes see that a refraction or a prescription may change over time, and when we do find these patients, we carefully examine them, and we typically find that the corneal shape is just as it was intended the day the surgery was done. So other changes can make it occur, like the length of the eye or the lens inside the eye, but fortunately touch-ups can be done to restore the vision again. But basically, LASIK is permanent. Most people are suitable for laser eye surgery, but if you're not, there are many other options that we will discuss during your consultation.
Monovision is a solution that we can use in refractive surgery to give you the power of being able to see for distance and near over the age of 45. Why over 45? Well, after 45, the natural aging process of the eye means that you can no longer see for distance and near at the same time. You can't focus. So in monovision, we take the dominant eye, correct it for distance, and we take the non-dominant eye and we correct it for near. And that nearness can be close, mid-range, or wherever to suit your own lifestyle and your expectations.
Yeah, feeling really good about the surgery today. Just had a couple of tests inside, and looking forward to reading and seeing how I did through the lenses when I had them in a couple of months ago. Excited, not too nervous, and really looking forward to having it behind me.
Mark has arrived at the clinic today for LASIK to correct his near vision. This type of procedure is known as monovision. We treat every patient individually, and if you have any special requirements, our dedicated staff will look after you. You are welcomed back to the clinic the next day for a short checkup.
LASIK surgery is safe. It's very safe. It's one of the safest operations in the world today. But unfortunately, there isn't one operation in the world today that is 100% safe or has a guarantee. The major complications from LASIK are probably infection and inflammation, and these occur maybe 1 in 10,000 cases. In fact, contact lens wear is associated with more infection than with LASIK. There are other milder problems. Dry eye. Dry eye is often associated with LASIK, but at this clinic we are very keen on picking out those cases before you actually have the surgery. So if you develop a dry eye, it's usually a temporary problem. And I'd just like to say this, that I think LASIK is so safe that both myself and my partner have had our family treated with LASIK at this clinic. The Wellington Eye Clinic uses the wave-light combination of lasers called the wave-light refractive suite. This consists of a femtosecond laser and the fastest treatment laser in the world today. The combination of the two lasers gives what we call bladeless surgery, and the aspheric profile that the laser uses is extremely successful in treating patients today.
Okay, 6 weeks on and I don't have any glasses anymore. It's fantastic. I had my check and it went great. I'm just adjusting now to not having my glasses, not having to put them on in the morning and not taking them off at night time, but that's just a habit and I'll grow out of that, so it's brilliant. Work is a lot easier now because I don't have to worry about glasses on my face. Life's brilliant. I'm loving not having my glasses.
So it's a week now since I've had the surgery, and the day of the surgery wasn't anxious at all. I had no reason to be anxious, and for those people who are terrified of people touching their eyes or having somebody touch their eyes, as I was a little bit, you don't even feel anything if anybody touching your eyes. So from that point of view, it was absolutely fantastic. So I went home after the surgery, went to bed as they said, a little bit stingy for the day, took loads of the drops, and the next day woke up and it was absolutely perfect. No stinging of the eyes, full clarity, absolutely fantastic. Back working the following day, it didn't interfere with work at all, and I suppose the biggest difference that I have found over the past week is obviously I'm reaching for my glasses every time I have to read something, and I don't have to, and it's just a huge excitement every time you have to read something. It's just wonderful, fantastic, couldn't be happier.
The Wellington Eye Clinic was established in 1980. We are the first independent clinic in Western Europe to use a laser to correct vision. There's a lifetime warranty on our laser procedures. We are situated on the Beacon Medical Campus in Sandyford, County Dublin. Our dedicated laser theatre is located within the clinic. To make an appointment or to make an inquiry, please contact the clinic. We look forward to seeing you at our clinic to start you off on your journey. Wellington Eye Clinic. See it our way.